Hi, my name is Felicia Carnevale. I'm a nurse practitioner student at Maryville University, and I'm going to be doing a head-to-toe assessment today for my advanced health assessment course. This is Don, my volunteer. Before he entered the room, we had him empty his bladder. We took a full set of vital signs, height and weight, and we had him perform a distant vision test with the Snellen chart and the near vision test with the Romberg chart. So first I'm going to start with the head and neck, and I'm visually inspecting the symmetry of Don's face, his eye placement, his cheekbones, his mouth, his nose, and that looks all good. I'm assessing his skin for oiliness or dryness, variances in pigmentation, and that looks all normal too. So I'm going to go ahead and palpate his scalp, and I'm looking for any masses or lesions or tenderness while I'm doing this. Okay, so that all looked good, and I'm going to go ahead and feel the texture of Don's hair, and it's testing if it's coarse or fine. I'm looking at the distribution of his hair, seeing if there's any thinning or baldness. So I'm going to go ahead and palpate Don's facial structures here. First I'm going to palpate the maxillary sinuses for any tenderness or soreness or swelling. His frontal. You can go ahead and palpate the structure of his face. I'm going to assess for TMJ. So I'm going to have him open his mouth, close your mouth. And I didn't hear any clicking. It wasn't tender, and the temperature was good. And that was cranial nerve 5. So next I'm going to assess cranial nerve 7 for, again, symmetry. I'm going to ask him to go ahead and smile, clench your teeth, stick out your tongue, move your tongue side to side. Go ahead and squint your eyes, puff out your cheeks. Okay, so they're all intact. So next we're going to go ahead and assess Don's eyes. First I'm going to visually assess him. I'm looking at his eyebrows and his eyelashes and his upper lids for any nodules, and they all look good. We're going to go ahead. I'm going to assess his conjunctiva, and there's no drainage, nice and pink. His sclera is nice and white, so that's good. So we're going to test his pupillary response next. And I'm going to have you look straight ahead, focus on something. Okay. And we're going to check his consensual response to his pupils. Okay, and they're all intact. Next, we're going to check his the 6 cardinal fields of gaze, his ocular eye movements. Okay, just look at that again. Just follow it with your eyes, not your head. Okay, and they're all intact. Awesome. So I'm going to go ahead and I'm going to examine his red reflex of his eye, and I'm going to also assess for stress bismuth. I'm going to have you do a cover-uncover test. So I'm going to go ahead and cover one of your eyes. Okay, now uncover it. Okay, the other eye, and uncover it. Okay, that all looks normal too. So I'm going to go ahead and look at, again, his red reflex of his eye. Okay, and I see his veins and the red reflex, and that all looks good. So next we're going to move on to the nose. I'm going to assess his nose, the structure of his nose. I'm going to go ahead and look inside his nose. And I'm looking at his turbinates and his septum, looking to see if there's any polyps, and that all looks good. So we're going to go on to the mouth, and I'm looking at his lips. They're nice and pink and moist. I'm going to look inside of his mouth. I'm going to have you open your mouth. And I can see the soft palate, the hard palate. His mucous membranes look good. His oral pharynx, his pillars, and the floor of his mouth. I'm looking for any lesions or possible oral cancers. Okay, and they all look good. So I'm going to have Don check his gag reflex. So I want you to stick out your tongue. Say ah. Okay. And again, I'm going to go ahead and look at his teeth. Open your mouth again. And I'm looking for the number of teeth and the color of the teeth. Yeah, look fine. So from here, we're going to go on to the ears. And I'm going to, again, assess the symmetry of the ears and the alignment of the ears. Check the auricle. And that's all good. We're going to go ahead and look inside Don's ears. And I'm looking at the tympanic membrane, seeing if there's any redness. I'm looking to see if the membrane is nice and pink and pearly, or gray and pearly, which it is. There's no inflammation there. So we're going to go ahead and test his hearing, and I'm going to do a whisper test. So I'm going to stand behind him. I'm going to say 2 words, 1 in each ear, and he's going to repeat them.
Pear. Apple.
Good. He's got great hearing. So we're going to go ahead and see if he can hear equally in both ears with the tuning fork. I'm going to place this on his top of his head. Go ahead. Go ahead and tell me if you hear that equally.
Same in both ears.
Okay. Next, we're going to assess bone conduction versus air conduction in his hearing. And I'm going to go ahead and place this on his occipital bone behind his ear for bone conduction. Tell me when you stop hearing it.
Stop.
And then the front of the ear. Tell me when you stop hearing it.
Stop.
Okay, great. I'm not sure if I can check patency of the nose, so we're going to go back to that. Cover one of your nose, one nostril. Breathe. Go ahead and do the other one for me. Okay, great. So now that we assessed basically the face, the head, and the eyes, and everything, we're going to go to the neck. And I'm looking again at the alignment of his skin tone and texture. I'm looking to see if there's any noticeable masses. I'm looking at the alignment of his trachea, which is in line. So I'm going to go ahead and palpate his trachea. Feels good. I'm palpating also his thyroid. It's nice and smooth. There's no nodules. I'm going to have you swallow when I palpate. And his thyroid moves smoothly up and down, so that's all within normal limits. So I'm going to listen to his carotid arteries with my stethoscope. With the bell on my stethoscope. Just kind of hold your breath for me for a little bit. Okay. And I'm going to listen to his thyroid, and I shouldn't be hearing anything in the thyroid. Okay. So I'm also going to palpate his carotids one at a time, so I don't occlude him. Okay. And they're good. So now that we've done the neck region, we're going to check for lymph nodes, and we're going to assess his preauricular. Again, I'm looking for any inflammation, his postauricular, tonsillar, submandibular, submental. I'm going to assess the pre-cervical, anterior cervical, superficial cervical, and posterior cervical. And again, I don't feel any inflammation or nodules in there. So next we're going to move on to assessing range of motion of his head. I'm going to have you put your head down. Okay, put your head back. Okay, look side to side for me. Okay, that's great. And can you do this? Does it hurt? Okay. I'm going to assess the strength of his head. So I'm going to have him push back on my hand. Good. Forward. Good. Just side to side a little bit here because it hurts a little. Okay. So that's all good. It's intact. He's got strong neck muscles. So we're going to go ahead and assess the upper extremities. And I'm going to lightly palpate. I'm looking for muscle tone and the temperature. I'm looking at hair distribution, and that all looks good. Assess his shoulder. And it's equal on both sides. I'm going to assess his brachial pulse and his radial pulses. And we'll do that on the other side. Put your hands out for me. We're going to assess his hands, and I'm looking to see if there's any clubbing. They're all good. I'm going to assess his nail beds, his capillary refill. Okay. And they all look good there. So we're going to go ahead and also assess his range of motion of his upper extremities. And I'm going to have him flex his arm like this. Extend your arm. Put your wrists out like that and back. Good. So go ahead and put your arms up. And I'm going to assess for the strength. Go ahead and push. Okay, put your arms like this. Push against me. Good. All right, so he's got good muscle tone and strength there. So we're going to go to his chest. We're going to look at his chest. I'm going to look at his skin. I'm looking to see if there's any noticeable masses there. I'm looking at his respirations, how he's breathing, if he's breathing heavy, shallow. And he's pretty much breathing normal right now. So we're going to go ahead and palpate his anterior chest wall. And I'm going to just palpate first to see if there's any masses. And that all feels good. I'm going to palpate his subclavicular. And his inferior clavicular. I'm going to assess his eggs. Put your arm up for me. His axillary lymph nodes. And I didn't, again, feel any inflammation, and they weren't tender, so that's great. So next we're going to, I'm going to check fremitus. So I'm going to put the palmar surfaces of my hands on his chest, and I'm going to have him say 99.
99. 99.
Okay, so I didn't feel like he had any consolidation. I didn't hear any difference in his voice tone. So I'm going to go ahead and percuss, and I'm listening for any dullness. Do it to the other side. And I don't hear any consolidation, and that sounds good there. So I'm going to also do this laterally. Okay, so now I'm going to check his heart, and I'm going to check for pericardium thrill, or heaviness, and that sounds good. His apical pulse, and that's good. So next, I'm going to go ahead and auscultate his first breath sounds, and I'm going to be listening to see if there's any ephetition sounds, such as rhonchi or wheezing. I'm going to also assess his, first I'll do his heart. I'll listen to his heart sounds, which first his aortic, his pulmonic, Erb's point, his mitral, PMI, again, the apical pulse, and that's all good. So I'm going to go ahead next and assess his lung sounds. Okay, good breath for me. In, 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 in. And then I'm going to do the laterals too, so take a good breath. On both sides. over time. Okay, so we're gonna go to his posterior. Again, I'm looking at his respirations, the number of respirations. If he's got any heaviness or shallow breathing, which he doesn't. I'm looking at the skin. I'm looking to see if there's, again, any masses. So I'm going to go ahead and palpate, looking for masses or tenderness in his chest. Go ahead and check for firmness, 99.
99. 99.
Again, I don't hear any consolidation, so that's good. So I'm going to go ahead and percuss. And I'm listening for dullness, consolidation, hyperresonance. That all. I'm going to go ahead and check his thoracic expansion. And I do this by putting my hands together here and looking at my thumbs. I do it about the 10th rib space. I'm going to have you breathe in. Again. Again. Next, I'm going to assess for diaphragmatic excursion. I'm going to start here on his left side here. Now I'm going to take a deep breath in for me and hold it. I'll tell you when to let it out. Okay, go ahead and let it out. So I'm going to mark this space. And next I'm going to have him exhale as much as he can, and then I'm going to go up from here. Exhale. Okay, so I marked this space. It's about 3 to 5 centimeters, which is normal. Now I'm going to go ahead and do it on this side. Take a deep breath in inside. Okay, and I kind of feel the dullness right here, so I'm going to go ahead and mark it. I'm going to go back up, exhale all the way out. Good, so I'm going to mark that space, again, 3 to 5 centimeters. The right's going to be a little higher, which is normal because you have the diaphragm sitting over the liver on the right side. So that's all good. So we're going to go ahead, and I'm going to auscultate. Go ahead and breathe in for me now. Okay. Okay. In. In. Good. In. In. Okay, so it's nice and clear. I didn't hear any wheezing or rhonchi. So from here, we're going to go ahead and assess his abdomen. I'm going to have him lie down. And I'm going to look at the contour of his abdomen, and I'm looking to see if there's any glistening or tightness, which might indicate ascites or any masses or whatnot, and it looks fine there. So first I'm going to auscultate. I'm going to auscultate, listen to his bowel sounds in all quadrants. Oh, he's got good bowel sounds right off. So. Okay. I'm gonna listen to his aorta artery and his renal and his iliac and his femoral arteries with the bell of the stethoscope. And I'm listening to see if there's any thrills or bruits. That sounds good. His renal arteries. I don't hear really anything but the pulse. His iliac. And then his femoral artery. Okay, great. So next I'm going to go ahead and I'm going to percuss, and I'm going to percuss for the border of his liver over here on the right side. Subclavicular line. And I'm going to wait until I hear dullness, which I do hear. I'm going to go ahead and percuss from up. And again, dullness for the liver here. And it should be less than like 8 centimeters. That would indicate normal size. So now the spleen, I'm going to percuss for dullness of the spleen. And that sounds good too. So I will go ahead and lightly palpate the abdomen. And again, I'm seeing for tenderness or any masses. And that's all normal. So I'm going to deeper palpate, and I'm palpating for the livers, or the organs here. So I'm going to go ahead and palpate for the liver. I'm going to see if there's any tenderness. And I really shouldn't feel the liver, because then it would indicate that it was being enlarged. I'm going to go ahead, palpate the spleen, and then his left kidney, just arch it back a little bit. Okay, and again, I shouldn't really be feeling his kidneys either, and it's not tender, so, and I don't feel any masses, so that's all good. So we're gonna sit up, and we're gonna go ahead and assess his lower extremities. And again, I'm looking at hair distribution and edema and any vascularities abnormal for that. And it looks good. He doesn't have any missing hair that would indicate a problem with his vessels. So next we're going to go ahead and palpate for the popliteal, the post-tibial, dorsal patellitis. And on both sides we'll do that. Okay, great. Now I'm going to assess for muscle tone and strength, and it feels good. Temperature, it's good. He doesn't, again, have any edema. So I want to test against strength here, so push against my arm. Good, normal, yeah. The hand. Good. Okay, that's all normal. You can do your feet. Push against me. Okay. Push against me. Good. Okay, so we're going to assess for reflexes. Now I'll do both the upper and the lower extremities. His brachial, his wrist. Okay, and his knee. There we go. Okay, great. So that's all intact too. We're going to have him stand up, and we're going to assess his back, his cervical, thoracic, and lumbar spine. And while we're standing up, I can also assess his costal vertebral angle here, see if there's any tenderness. You feel any tenderness? Okay, go ahead and turn around and bend over, so like you were touching your toes. You don't have to go that far. And I'm looking to see if there's any curvature of the spine, and that looks good. You can stand up. And I'm looking at the placement of his hips against his knees and whatnot. So, and that all looks good. So that concludes my head to toe assessment.